Hi, my name is Natalie Spanitz and I'm a student nurse from Cedar Crest College. I did my research critique on spirituality and spiritual caring, nurses' perspectives and practice in palliative and acute care environments. This research was conducted by Susan Ronaldson, Lillian Hayes, Christina Agar, Jennifer Green, and Michelle Carey. Research purpose. The purpose of this study was based upon three main goals. The first goal was to identify and compare spiritual caring practice in palliative and acute care RNs. The second goal was to determine any correlation between palliative care and acute care RNs' spiritual perspectives and their spiritual caring. The third goal was to investigate perceived barriers to spiritual caring by both RN groups. The focus of this study was to explore nurses' perspectives of spirituality and their practice of spiritual caring in two clinical environments, those two environments including palliative and acute care. The outcome intended to raise the profile of spiritual caring amongst all nurses. Research problem. The problem of the study is that spiritual caring has been viewed as a difficult area for nurses to comprehend. This could be due to the unclear nature of spirituality and the undefined concept of spirituality in nursing. This is significant to nursing because not much research has been done on spiritual caring in the nursing practice. This research will provide new knowledge to the unclear and undefined concept of spirituality in nursing, thus providing nurses with the education and means to spiritually care for their patients. Research questions. There are 6 research questions identified in this study. The first research question was, do perspectives of spirituality differ between palliative and acute care RNs? The second, do RNs practice spiritual caring in palliative and acute care environments? The third, does spiritual caring practice differ between these two groups of RNs? The fourth, do RNs' perspectives of spirituality influence their practice of spiritual caring? The fifth, what barriers to spiritual caring are experienced by RNs in palliative and acute care? And the sixth and final question was, do RNs' spiritual perspectives and spiritual caring practice influence barriers to such caring? In this study, there was no framework, map, model, or interventions identified. Also, no variables were within this study. Setting and sample. The setting took place in 7 metropolitan health services in Sydney, Australia. The 7 health services included 1 community palliative care service, 3 palliative care services, and 3 acute care services. This sample size consisted of 42 palliative care registered nurses and 50 acute care registered nurses. The inclusion criteria was the consultation with the Director of Nursing Services from each participating location. The exclusion criteria was the registered nurses who worked in high dependency acute care facilities. Although these RNs were invited to the study, they were not recruited. Ethical components. Ethics approval was obtained from institutional ethics committees prior to the onset of the study. It was also indicated that an informed consent from the directors of nursing services was given to their staff. Data collection. Data was collected using a cross-sectional approach. Also, 3 tools were utilized to collect data, the first being a socio-demographic survey. The survey's components included age, employment history including RN, specialty, position, and facility, gender, basic qualifications including certificate, diploma, and degree, graduate education and specialty, and cultural background being English speaking or non-English speaking. The Spiritual Perspective Scale, or the SPS, was also utilized in this study. The SPS measures a person's view on the extent to which they consider that spirituality has an impact on their life and their engagement in interactions or activities that are spiritually related. The Spiritual Care Practice Questionnaire was also utilized. That is the SCPQ. And the SCPQ measures the frequency of assessment and interventions related to spiritual practice and the barriers to providing spiritual care. Only one limitation was identified in the study, and that was that RNs were recruited from a targeted number of acute care environments to limit diversity. So if an acute care RN did not work on a general surgery, orthopedic, medical, or coronary care unit, they were not included in this study. Overall, this could have impacted the study. The results. So the researchers found that spiritual caring and perspective was higher in palliative care RNs than in acute care RNs. It was also found that palliative care RNs were generally older and had more experience. It was also concluded that palliative care RNs practiced longer in their specialty area. Both palliative and acute care nurses identified insufficient time as their number one barrier to spiritual caring. In addition, acute care RNs also identified patient privacy as a barrier. And finally, it was found that acute care RNs may benefit from additional support for their spiritual caring. Implications for nursing practice. It was implicated that there should be an increase in RN spiritual awareness and spiritual caring. It was stated that nurses must overcome the barriers that were identified in the study, being the insufficient time and the patient privacy. It was recommended that spiritual caring needs to be learned early on in education, thus meaning that spiritual caring should be learned in nursing programs. Also, it was stated that acute care RNs should be provided with education and support through the means of specific for their environment and through the use of mentors. Also, there is a need to determine if a nurse's spirituality is a prerequisite for effective spiritual caring. And finally, it was recommended that nurses document their spiritual caring and articulate their spiritual caring with their colleagues. This is a citation for my critique, and thank you for watching, and I look forward to answering any questions you may have.